glaring so much. I don't know how to fix this up. There's so much of
No, it doesn't matter.
laptop light. It's okay. Doesn't matter. So my daughter is also in Mumbai. I don't know whether you know her. She's Sejal Kumar, her mom.
Oh, of course, of course.
Hmm.
Okay, I think we're live now.
Yeah.
So I would like to say hi to all the people who are watching us. My name is Chavi Mittal. I'm going to be taking you through this session today, which is brought to you by Policybazaar. It's a session all about health and wellness. We'll talk about a lot of things related to health today, as usual. But today's session is special because it's dedicated to all women. 8th of March was International Women's Day, and today we are going to celebrate women but also talk about one of the most common cancers that affect women. I'm talking about cervical cancer, which is the fourth most common cancer that hits women globally. And to answer some of the most asked questions, we have with us Dr. Anjali Kumar. She's an advanced laparoscopic surgeon and a specialist in high risk pregnancies. She has an extensive experience of 35 years in this field. She's the director of obstetrics and gynecology at CK Birla Hospital, Gurugram, director, the Gynac Clinic, Gurugram, and the founder of Maitri. Maitri is a digital platform on women's health with a following of around 7.5 lakhs. And it's a digital space on different social media platforms where women can talk about all their health issues and get medically authentic information about everything. And it talks about pregnancy, PCOS, fertility, and sensitive taboo topics of contraception, vaginal health, and sexual health in an easy, non biased, and approachable manner. So, welcome, Dr. Anjali.
Thank you very much for inviting me over. I'm so glad to be here. Thank you very much, Policybazaar, for inviting me to talk to you people, lovely ladies and their male friends and counterparts, to talk about something which every man and woman both must know. And as you rightly said, this is the International Women's Day month. So, not that we deserve a month or a day, we deserve every day of the year. So it's important to talk about all these things, and let's get on to the topic.
So I know that there is absolutely no reason why cancer would attack anybody. But still, let's start by understanding what exactly is cervical cancer.
Yeah. So before that, as a doctor, I get such funny answers when we talk about cervical cancer from the patient. When I tell them cervical, can you imagine the most basic doubt people have is cervical is hair. We are in 22nd century and still not many people know what is cervix. So for all of you who are watching today, cervix is the mouth of uterus. आपकी बच्चेदानी का मुंह. That is known as cervix. The cervix is hidden deep inside. It's deep inside. You can't see it from outside. That's the reason most of the cases of cervical cancer are diagnosed very late because the people can't really see it. So when the cancer happens at the cervix, the mouth of uterus, that's what is known as the cervical cancer. And as rightly said by Chavi, it is one of the commonest cancers. It's the fourth most common cancer in a woman's body. So it's high time we know about it. It's high time that we talk about it.
Okay, so like you said, cervix is located deep inside the body and you cannot externally see that organ. So what are the symptoms that people should look out for?
Hmm. So, unfortunately, once again, once you start getting symptoms of cervical cancer, it's already too late. So, we are supposed to catch the cervical cancer before it starts causing any symptoms. That's why it's very, very important to be preventive in our approach and go for the regular examinations so that we can pick up the cervical cancer before it can cause any symptoms. So, since you asked me about the symptoms of cervical cancer could be dirty, foul, smelly vaginal discharge. It's like a rotten smell which comes from the vagina. That's the symptom of the cervical cancer. A person may bleed in between the periods. The person might bleed after a sexual intercourse. The periods could be heavy. There could be pain in the lower abdomen. The woman might lose weight. But then we don't have to wait for all these symptoms because in case we are seeing a woman at these symptoms and then diagnosing the cervical cancer, that means as a society we've lost the battle.
Absolutely. So what are the tests that somebody should do? to detect the cancer in time?
So, so most important thing is I tell all the women that you deserve an yearly health checkup. Come what may, you must go to a doctor, a gynecologist every year. As women, we are always in the habit of looking after others in our family, be it your child, your husband, your grandmom, or anybody, any senior in the family, senior, junior. Your health always comes late. सबसे late में कि okay जब मैं सब काम खत्म कर लूंगी then I'll go to the doctor. So that's the mindset we are supposed to change. We need to be preventive in our approach. Only when we go to the doctor, we talk to the doctor about our symptoms, get an internal checkup done, get a pap test done, get an HPV test done. That's how we can pick up the cervical cancer well in time. Nowadays, we have tests available by which we can pick up a cervical cancer in a pre-cancer stage, maybe 5 6 years before the cervical cancer actually develops. So we have a long window, and in case we have missed that window, you know we are going wrong somewhere in our approach,
Mhm.
that means.
So when you talk about pap smear and HPV, what are these tests exactly?
Okay, so let me put it in a very simple language. HPV stands for human papilloma virus. Now, this is the virus which is known to cause the cervical cancer. Fortunately or unfortunately, cervical cancer is one of the very few cancers in the human body for which today we know the cause. Most of the cancers, we do not even know what is the cause of that cancer. But cervical cancer, according to most of the scientific studies, is caused by exposure to HPV, human papilloma virus. But we do not know why HPV triggers some abnormal precancerous and cancerous changes in some women. We still do not know why are some women unfortunate. It is said that HPV happens to almost 80% women, 80% women at some point in their lives. But it's only in very few women HPV triggers those changes. So, in case we are able to do a test by which we can detect the presence of HPV in the cervix, and by doing a pap smear, we can pick up some abnormal changes in the cervix. That means we've done the job. We should be able to pick up the cervical cancer well in time.
And how does one get exposed to the HPV virus?
No reason. Most common reason is the sexual contact. That's why cervical cancer is very, very rare in virgins.
Okay, so that brings me to my next question. Like, who is at risk of cervical cancer? How early? What age group? How does
Hmm.
that work?
So, once again, I say this to my patients: anybody who has a cervix is at risk of getting a cervical cancer. So, any woman who has a cervix intact is at risk of getting a cervical cancer. There are certain risk factors in a woman's life which predispose her to increased risk. For example, an unsafe sexual practice or a sexual behavior, which means that you're not using barrier method of contraception, you have multiple sexual partners. In case you have been exposed to some kind of a sexually transmitted diseases, you've not got it treated. So, untreated sexually transmitted diseases increase the risk of HPV, and not getting a regular examination done. A woman who's smoking multiplies the risk of cervical cancer many times. So these are the things which are absolutely controllable things. I mean, you can control how much do you smoke. You can control the risk of your sexual behavior. You can get your STIs treated in well in time. So all these things are well in control. In case you're aware and you take care of these risk factors, get a regular examination done, and of course we'll talk about the vaccine also. I mean, there's no reason why we should get the cervical cancer. Just to get you an interesting statistics on this, India accounts for one-fourth cases of cervical cancer in the world. Now just think of it. What is it which we Indians have done wrong? Why is it that 25% of new cases of cervical cancer happen in India? 25% of women dying all over the world from cervical cancer are from India. Now, this is a very sad statistics. This happens because we as Indians are not preventive in our approach. हमें जब सर्विकल कैंसर हो जाता है तो हम डॉक्टर के पास जाते हैं. We don't go to the doctor so that we don't fall ill. That's where is the difference.
And also, you didn't tell us about Pap smear. What's a Pap smear?
Okay. So pap smear is a very simple test. It's done by doing an internal examination. Obviously, for this, you need to go to a gynecologist. The gynecologist is going to use a small instrument to open up your vagina, look at the cervix, and use a small brush or a spatula just to scrape the cells from the cervix, from the surface of the cervix. And that slide is then sent to a pathologist to look for any abnormal cells. And we also look for the presence of HPV in that. It's a very small test, takes barely 2 minutes. It's not painful, not very expensive, should be done every 3 years. Not
Oh,
every 3 years, from the age of 21 years and yes, throughout till the age of 65 years. Every woman, whether she is sexually active or not, must get a pap smear done every 3 years.
hmm. And is it also something which is genetic?
No. No, cervical cancer is not genetic. Cervical cancer happens because of HPV. And then, like I said, there are certain factors in a woman's life which make her more predisposed towards cervical cancer, but it's not genetic.
Let's talk about the vaccine.
Hmm. So, any infection usually have two types of prevention. One is primary prevention, second is secondary prevention. So, primary prevention is that you don't let the infection go in. So, supposing you will take a vaccine against this virus, that means the virus will not be now able to go inside the body. Second is secondary prevention कि virus अब अंदर चला गया. Now we want to pick up the disease at the earliest possible stage. So that's what we do by doing a pap test. So when we nicely combine the primary prevention and the secondary prevention, that means we've done our job well. So nowadays we have a vaccine available, which is advised by all scientific bodies in the world that this vaccine can be given from 9 years of age onwards. So, for all those women who have young daughters, please consider giving your daughter giving this vaccine from 9 years till 15 years of age. You need only 2 doses of the vaccine. From 15 years of age onwards, you would need 3 doses of the vaccine. So, the best time to get the vaccine is 9 to 26 years of age. 26 to 45 is known as a catch up vaccination. कि आपने नहीं लगाया तो चलो, now let's get it done. Why this is called catch up? Because most of the women probably would have been exposed to HPV by then. Beyond 45 years of age, there is no point of getting an HPV vaccine. And now we have different types of vaccines. Like when initially, I think about 15 years or so, HPV vaccines were launched for the first time. That was a time when we had a bivalent vaccine, which means that the vaccine was effective against two types of viruses. Then we had a quadrivalent vaccine. This vaccine was effective against four types of HPV. By the way, we have almost more than 200 types of HPV. Some of them are high risk, some of them are low risk. But today, nowadays, I think about 1.5 years back, we had Gardasil 9, which is a nanovalent vaccine, which is effective against 9 types of high risk HPV viruses. So please go ahead in case you've not taken the vaccine. Please talk to your doctor, get the vaccine. And what we hear is India is soon going to launch its own indigenous HPV vaccine, which is going to be very, very cheap, almost to the tune of 400 to 500 rupees, fingers crossed. If that happens, then we have no reason to say why we haven't vaccinated our women. So that should hopefully happen by end of this year.
Okay, so you're saying that after the age of 45, there's really no point in taking the
Yeah,
vaccine.
no
I'm
problem.
42. Should I be taking the vaccine?
Bilkul, bilkul, bilkul.
And how many doses will I need?
You would need 3 doses, but one
Over
more
a span of
important.
how many years?
Wait a minute, wait a minute. So one more point which I want everybody to understand is that vaccine and the pap smear have to be combined. In case you've taken a vaccine, it doesn't mean that you don't need a pap smear. Or in case you are regular with the pap smears, it doesn't mean that you don't need vaccine. So the pap smear and the vaccine both go hand in hand. Both need to be done together. So, like for you, Chavi, in case you've not taken a vaccine, for you, more important would be to get a regular pap test and a regular internal examination by a doctor. But for all those people who are fortunately, no, I think fortunately is not the right word, who are on a younger age group, we all are fortunate. So remember, pap smear and HPV, both pap smears and the vaccine,
The vaccine.
both have to go hand in hand. They are complementary to each other, but they are not replaceable by each other.
Right, right. And my daughter's 10, so I should give her
Please,
two doses.
absolutely, absolutely. Talk to your pediatrician, ask for the HPV vaccine. The earlier we give the vaccine, the better it is. So, the idea is before our girls get exposed to HPV, we do not know when our girls would be sexually active. So, it's important to have the good immunity against the HPV virus before their first sexual contact.
And again, how far apart do these three doses need to be for somebody at my age?
Okay, so let's talk about two doses. Somebody who's taking two doses from 9 to 15 years of age, you need two doses, 0 to 6 months. Zero is today, in case you've taken a vaccine, 6 months later, you need the second dose. But supposing we fall into that three doses bracket, which is from 16th year onwards, you need three doses. So it is 0, 2, and 6 months. Today you've taken the first dose, second dose is 2 months later, and the third dose will be 4 months after the second dose or 6 months from today. So 0, 2, and 6 months.
Okay. ओके सो लाइक यू वर सेइंग कि इंडिया में लोगों की जो मेंटालिटी होती है डॉक्टर्स के पास जाने की वो ये होती है कि जब हम बीमार होंगे तब डॉक्टर के पास जाएंगे और अपने आप का चेकअप करवाने नहीं जाएंगे। एक और छोटी सी जो मेंटालिटी होती है हम सब लोगों में वो ये होती है कि वैक्सीनेशन लेंगे तो साइड इफेक्ट्स हो जाएंगे।
Hmm.
तो आर देयर एनी साइड इफेक्ट्स टू दिस वैक्सीन?
So when you have unprotected sex, उसके side effect का कोई सोचता है? When you don't use a condom, उसके side effect का कोई सोचता है? यहाँ पे there is a vaccine who's promising you such a good thing. There are multiple trials which have happened, and we are questioning that. I remember this was the scene which happened for the COVID vaccine.
या
When the COVID vaccine did not come, everyone said, "Oh, the government is not doing anything. Why hasn't the government given the vaccine?" The moment the vaccine came, and then everyone, "Oh, this is the side effect. That's the side effect." And we are not ready to, you know, grasp the positive part of something which is being offered to us so fast. And I remember every day people used to talk about that. And I really feel as doctors, we were saved because of the COVID vaccine. We were amongst the first people who got the COVID vaccine. And after the vaccine, really the mortality and the morbidity which happened in the doctors drastically came down. So, till now, again, coming back to the HPV vaccine, whatever data we have got till now, the vaccine has not been found to cause any major side effects. Of course, there could be side effect of anything. I mean, any treatment, anything for that matter, can have some side effect. There are bound to be some people who would be allergic to something. So some people might have an allergic reaction. Some people might have some pain or pain at the site where you take the injection. Maybe some kind of a fever. But we need to understand, look at the larger picture. What is more important, the risk of a cervical cancer or those minor side effects?
So what you're saying is these minor side effects are only temporary
Yes.
and they will get okay in a few days. So we should obviously
Yes,
look at the bigger
maybe
picture here.
2 hours only.
And I really wish there was a vaccine for all kinds of cancers, and we have a vaccine for this. So definitely, why not take it?
Yes.
Okay, now let's talk about somebody who has cervical cancer. Okay, is it curable? What is the treatment?
So, like I said, in case we, it all the prognosis of the patient, prognosis means how that person is going to do later, depends upon what is the stage of the cervical cancer. Very early detected cancers, when a person is almost in a precancerous stage or maybe in the stage one of the cancers, they can be treated very well. Stage two and three also can be managed. That's not a problem. But we need to understand as the stage of the cancer goes up, the the final prognosis definitely goes down as the stage of the cancer goes up. So after, we as doctors, we talk about 5-year survival rates. So 5-year survival rates fall down as the stage of the cancer go up. It will be technically difficult for me to talk about. It's a technical information. Stage one में कितना 5-year survival होता है, 2 में कितना होता है. But the point which people must understand that it is a preventable cancer. Preventable cancer. There are only few cancers in our body which are preventable. Most of them we do not even know the cause. हम prevent क्या करेंगे? This is one of the cancers which is a preventable cancer, and we must use all possible things like a vaccine, a pap smear, a regular checkup, so that we don't even get it. But in case you are lucky enough where your cancer is picked up at a very early stage in your annual checkups or pap smear, it's very much likely that you can have a complete treatment.
So, like chemotherapy,
Once again,
surgery.
it depends upon the stage,
But
the body's
let's say
usually
it's detected.
combination. Yeah,
Let's say it's detected at an early stage.
yeah. Then we do a surgery followed by sometimes radiation and chemotherapy.
Okay. And you were saying that the symptoms of the cervical cancer start appearing only at a very later stage. So if you're not
Yes,
doing your tests regularly, you
yes,
might be too late. And
yeah.
that is a stage where treatment options might not always work.
Yes, treatment options are very, very less by then. So you don't have to wait for the symptoms. You can't say, okay, I'm not having any symptom, so I don't have it. It's only if your pap smears are clear, then you can say, okay, yes, now I can be relaxed.
Hmm. Okay. And what part does regular hygiene play in preventing this cancer? And what other ways can be followed to prevent this?
So, like I said, the most important is a regular checkup and a pap test.
Hmm.
More than the hygiene, I don't think so. In today's world, women are hygienically that bad that you're actually inviting an infection. Most of us are hygienically pretty decent, right? But more important that is a responsible sexual behavior,
Hmm.
which is very important. So remember, any unprotected sex puts you at the risk of acquiring STIs, HPV being one of them. So make sure about the history of your sexual partner. ठोक बजा के पूछो भाई उसे. It's very, very important. And use a barrier method of contraception. And in case anytime you detect any symptoms which could be suggestive of a STI, like any dirty discharge or boil or some kind of a rash or a bump, do not waste time, get yourself treated. Even if it is not HPV infection, a bad STI puts you at the risk of acquiring HPV. So any
Right.
infection in the genital tract must be treated ASAP.
सो गाइस आप लोग सुन सकते हैं कि ये एक ऐसा कैंसर है जो डिटेक्ट किया जा सकता है अर्ली और आपकी लाइफ बचाई जा सकती है सो आई थिंक व्हाटएवर मेजर्स आर अवेलेबल टू अस वी शुड डेफिनेटली मेक यूज ऑफ देम एंड आई वांट यू गाइस टू पुट डाउन इन द कमेंट्स when was the last time you did a pap smear test for yourself? Doctor, when was the last time you did it?
2.5 years back.
Good. So 6 months may you're due. I think I did it 10 years back. So I'm like pretty much due 3 times over. I
Mm.
should do it. But okay, a personal question. I am a breast cancer survivor and I had the cancer last year. So I just did my regular MRI scan. The first follow-up that I did happened in Jan. If there is something wrong, will that also show in the MRI?
Mhm.
Right? So I can avoid the pap smear.
No, 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 no,
No.
no. No, no, no. The pap smear picks up the abnormal cells on the microscope. So when we make a smear, we put that smear under microscope, and now on the microscopic examination, we can study those abnormal changes on the cells. Now, when you do an MRI, MRI looks at the gross things, what's happening to your uterus, cervix, ovaries. But in case there are microscopic changes happening in the cell, even a naked eye cannot look at it. Like I can't look at a cervix and say it's normal unless and until I make a smear out of it and then put that smear under a microscope. I'm not sure.
Okay, so pap smear is a must.
Yes, it's a must for every woman. Remember, every woman more than 21 years of age, every 3 years, whether you're sexually active or not, till the age of 65.
Okay. Let's also talk a little bit about the other diseases that are very common with women, like PCOS and PCOD. First, tell me what is the difference between the two?
So, PCO, PCOD, PCOS, they're all same. So, this is polycystic ovary. It's a new lifestyle disease. It's the new gynecological epidemic. And surprisingly, today, 1 in 3 to 5 women suffer from PCOS. That is the magnitude of a problem. Today, women have irregular periods, they get acne, they get facial hair, they seem to gain weight because of, without any reasons, they have trouble conceiving a baby. So these are all signs of hormonal upset and PCOD. So in case you're suffering from all this, once again, please visit a doctor, get yourself examined, get a good diagnosis made. Most of the cases of PCOS can be managed very well by a lifestyle modification. So gone are the days when we used to relish our roti, sabji, and dal chawal. Today, people are happy with their pizzas and burgers and cookies and so-called fancy good things in life, which are actually not good. So we have to once again learn to eat clean, eat things which are very, very basic. Make sure that we are physically very active. You know, human body is designed to be physically active. We were not designed to be sedentary. So when we are physically inactive, when we're eating the wrong things, plus when we have a lot of stress and worry in life, that's what predisposes us to getting PCO. One of the very basic things which increases the risk of PCO is lack of good quality sleep. Can you imagine today people do not sleep? When I talk to patients, people say, oh, I sleep at 1 o'clock, oh, I sleep at 2 o'clock, and then I get up at 9 o'clock, or I get up at 10 o'clock. Or sleep which is adequate, sleep which is not disturbed, sleep which is according to circadian rhythm, day and night. That is something which will prevent PCOD. Now, these are very, very simple things which anybody can do, right? But in case you are, all these things are not helping you, then definitely you might need some treatment. Go and visit a good gynecologist. PCOD, if it is left untreated, can be very, very problematic. I mean, no woman likes to have hair on the body. No woman would like to have less hair on the scalp. No woman likes to be obese. So, other than these cosmetic things, it can cause diabetes, hypertension, increased risk of cancer. So, it's not a small thing. So, please go and visit a doctor. And as much as
Okay.
possible, try and clean up your lifestyle.
So, I do so many of these health sessions with Policy Bazaar, and at the end of every session, the biggest takeaway is what you just said. By just correcting your lifestyle, by just taking care of what you put in your mouth and what goes inside your body, by just taking care of your sleep habits and your stress levels and just getting a little bit of exercise every day, almost everything can be kept under control. And still, people refuse to do that. So, all of you who are watching this session, let's just try to get control of our lives and get it back on track. Sometimes I feel now you're saying that you should sleep as per the circadian rhythm, and I feel really great about myself because I sleep at 8:30 and I wake up at 6 and I get good sleep, and I'm really proud of myself. Although I don't have a friend circle left anymore, but I love the way my life is
That's worth
shaping
it.
up.
It's okay. It's okay.
Absolutely.
Good health is what we should be always looking at.
Absolutely. And I think you don't need a life altering illness to teach you that. You can just get back on track as it is. So, this was a great session, Doctor. Thank you so much for giving us your time. And I hope the audience also enjoyed this session. And please join us for the next session that we have on another Sunday with Policy Bazaar. This is both of us signing out. Love and peace from us to you.
Yes. Bye bye. Thank you.